I'm Stefan Tolan. I'm an orthopedic surgeon here at Steadman Hawkins Clinic. I've been practicing orthopedic surgery now for about 12 or 13 years. I did 3 years active duty in the Army after I finished my residency, and then I did a fellowship in sports medicine, and I've been practicing here in Greenville for about 10 years, focusing mostly on disorders of the shoulder and elbow. I chose medicine mostly, I guess, because my parents were involved in medicine. My dad was a physician and my mom was a nurse, and I kind of grew up in a medicine environment, listening to what they did with their work and with their patients, and that stirred my interest in medicine. I grew up in Columbia, went to college in Spartanburg at Wofford College, and then did my medical school and orthopedic residency in Charleston at the Medical University of South Carolina. I then went in the Army on active duty for 3 years in Kentucky, and then did a shoulder and elbow fellowship along with a sports medicine fellowship in Jackson, Mississippi with Dr. Savoy and Dr. Shelton. There I learned more of the specific techniques that I can utilize in my practice today. I do mostly sports surgeries. I do a lot of shoulder surgery. Probably 75% of my practice is on shoulder and elbow surgery. I do arthroscopic rotator cuff repair and arthroscopic shoulder reconstruction. But I also do all other disorders of the shoulder and elbow with replacements as well. I also focus on sports injuries of the knee. I think my participation in competitive triathlon really helps me treat athletes. I've developed a great understanding of the mechanics of running, of shoe wear, of nutrition, of hydration, and I think all of these things just help me tie in to get a better understanding of what people are trying to accomplish. It also helps me understand their competitive nature, that they really want to get back and they don't feel like they can be down for a week or 2 weeks because they feel like they'll get out of shape. I think my competing in the same sports and different areas that they are just helps us be on the same page. Also, having been an active athlete and having undergone knee surgery, that also helps me get them through surgery, so I can help them understand what they need to expect and when they can train and what they need to do different. I think a patient should expect honesty from their surgeon. I think they should expect compassion from their surgeon, and they should expect the surgeon is going to be someone who will help them get through the whole process. Steadman Hawkins offers a lot of advantage to people. We have many surgeons with many different subspecialties. If we feel somebody would have better treatment from one of our partners, we'll easily refer them over to make sure that they get the best treatment for their particular condition. We all focus on individual subspecialties, and that helps us gain our skills in these areas and also helps us provide better treatment to these patients. I think Steadman Hawkins also can provide the whole package of treatment. We can provide the non-operative treatment, we can provide the surgical treatment, and we can also provide the post-operative treatment. I think a lot of people are fearful when they go see a surgeon that they're just going to have the recommendation for surgery. I'm very conservative before I recommend surgery. We'll try all the conservative things that we can do to try and make the problem better, and my main thing is to consider surgery not as a first-line treatment, but further on down the road, and then when all the other measures have failed, then recommend surgery, and then we can go through the experience together and get the problem taken care of. I'm married. I've been married for 20 years. I have 3 daughters. My oldest now is in high school, which is a new thing, we live here in Greenville. We're happy here. For me, the most rewarding thing about being a doctor is making people better. I think that's what gives me the best joy out of my job.